Why are we placing implants that go at an angle and not straight up and down?
In order to place longer implants. The longer the implants, the more bone you can engage, the better the retention, the better the longevity of the prosthesis.
When people see scans of implants, they assume that they just need to be straight up and down, but that's not the case, right?
That's not the case. We're trying to prevent traumatizing the anatomical structures. There are limitations. For example, on the top, if they have good bone, the sinuses are pneumatized, means they're falling lower close to the alveolar bone. We can't go straight into the sinus, right? So we have to angle the implants to engage the large part of the bone and be able to still provide them with the teeth in the back. So the sinus is right here. This is right here is sinus. This is where my first implant will go, right where we extract the molar, clean everything out. The insertion of my first implant will be in this direction. And we're gonna pretty much kiss the wall of the sinus. This way, we're able to give our patients molars on the back so they can chew, able to put in the long implant without interrupting the membrane or the wall of sinuses, keeping in mind that we don't want the implant to insert into the nasal floor. Normally, the sinuses are where the molars and the premolars are, right? The teeth in front of the molars. So in order to create a prosthesis and not have a long cantilever behind the last implant, you have to angle that implant, which is fairly common when we do all-on-4s. It's pretty normal to angle the implants, right? And get a longer length in there so that we can engage more bone. So if I'm placing this implant, and let's say this looks like to be in between somewhere 30 or 45, we do have different multi-unit angles that will go here, and actually it'll curve out straight. So the screw channels are all parallel to each other. Doesn't matter which direction the implants are being placed. It has different angles. It can be straight, it can be 30 degrees, or it can be 45 degrees. So it prevents, one, you don't have a longer cantilever on the prosthesis, because if you do, chances are the implant will have too much forces. And we have to keep in mind when we are placing these implants, they have to be torqued at a certain number in order for the forces to be loaded onto these implants. So you have to have longer implants, and to spread them apart, you have to angle it at the back.